Communicating people's own language is so important because there are nuances, subtle ways in which people communicate themselves emotionally in their language that you're not going to get through a translator. Perhaps you're not going to get just trying in broken Spanish to understand what's going on. And the only way to fix that is not to get more interpretation lines, although that's really important, that every hospital, every clinic, every office should have a good interpretation line. But it's to train more Hispanic doctors. I mean, that's clearly the key. And it's not just Hispanic doctors, Spanish-speaking doctors. It's people in their own communities being able to see doctors of their own background so that they can feel comfortable with those people in their languages.
I would say there's still a tremendous amount of stigma associated with HIV. Imagine a patient finally coming in for care only to realize that they're going to have an extra person in the room because an interpreter is needed, or even if the interpreter is available remotely, virtually, to fear that that interpreter might recognize their voice and then disclose their status. As far as the benefits of and the real need for language concordance is that there are many studies that have demonstrated improved care outcomes. So we know that language concordance results in fewer medical errors. It improves adherence to treatment. It improves satisfaction with care. When the provider speaks the same language as the patient, they're better equipped to build rapport and bond with the patients. And that's especially important when discussing sensitive topics such as sexual health.
Patients in the Hispanic community have a whole host of identities. These might impact their access to HIV care. A typical Hispanic patient could be at the intersection of mixed race, bilingualism, mixed citizenship, and because of this, a provider should approach an Hispanic patient with that lens in mind. Meaning they should appreciate that a patient might have a multitude of different aspects of their identity that might influence their access as well as their understanding and their follow-up to care.
Because of the extremely broad range of ethnicities, religious beliefs, and cultures, both shared and in difference between our community, providers should attempt to better understand the patient they have in front of them, not taking at face value the fact that that person speaks Spanish, and assuming, as a result, that they understand their cultural norms and beliefs. This is in line with the Center for Disease Control's guidance for providing culturally competent care, which integrates and transforms knowledge about individuals and groups into specific standards, policies, practices, and attitudes in appropriate cultural settings to increase quality of service and produce better healthcare outcomes.
Most HIV patients have multiple questions and concerns. Addressing these concerns with someone from their own community will help significantly. It makes communication flow naturally, and patients are inclined to ask more questions.
We need a workforce that represents the tapestry of our communities as it relates to ethnicity, gender, sexual orientation, socioeconomic status, everything. I think when patients come to see me for evaluation of a new HIV diagnosis, they're usually at their most vulnerable. They're scared. They often haven't told a single person they know, not a friend, not a partner, not a family member, much less coworkers, that they are facing a new diagnosis, and they really, really need support. So they need someone who they can feel comfortable asking questions in their own language about how they might have acquired HIV, how to avoid transmitting HIV to their loved ones, about whether or not they need to tell their employer, whether or not they need to tell their partner.
Family values of collectivism, unity, and familismo are both something that can be positive and negative. These values could provide a strong support network for the patient who is seeking HIV care because of a new diagnosis, or for somebody who is wanting to prevent HIV by seeking PrEP. However, because there is a lot of stigma surrounding HIV, in particular within the Hispanic community. These values can make it so that the care of HIV or preventing HIV may not be prioritized. And with feminismo, we tend to prioritize the greater good of the family as opposed to the individual. And because of that, and the associated stigma behind HIV, it is something that may not be adequately prioritized.
Those who are going to go into healthcare, whether they're doctors or nurses or any other healthcare field, is don't forget where you came from. Don't forget the time when you were young and scared of being infected with something or sick with something. Don't forget what it's like when your own family members get sick. You know, have empathy. Understand that this is a job for us, but it's a life for the people that you're sitting across the table from. And, you know, it is so important for people to feel cared for and to feel like the doctor in front of them cares about them. And that would be my advice, just to really not forget that we are in a health care field.